I've seen the role of probiotics in our clinical setting go from quackery, the perception by the physicians that it was quackery, no data, to an actual hardcore science approach. We now understand mechanisms of probiotics at the cellular level, at the nuclear level. We understand the outcome benefits were significant in decreasing infections, decreasing pneumonia, increasing bowel motility after surgery. So there's numerous benefits today. You know, we had these observational trials where people would give the probiotics and show a better outcome, but we didn't understand mechanisms. And then the science followed. We started to say, what is the mechanism? Now we can tell you down to what enzyme they're working at and what part of the nucleus they're turning on and turning off. So weaving probiotics into a surgical practice really comes from understanding the data. Once they understand the data and the preventative abilities of preventing antibiotic-associated diarrhea, preventing post-op infection, it becomes a natural. It's easy to do, it's very safe, and it's really not created any significant problems in a normal host. The outcome benefits of probiotics are virtually in every specialty of medicine. I'm a clinician and work in intensive care with trauma patients and surgery. So in my case, we know in trauma patients we can decrease days in the ICU, we can decrease days on a ventilator, we can decrease ventilator-associated pneumonia, we can decrease antibiotic-associated pneumonia. There's even now data that when you sew the bowel together after removing a piece of bowel, that you decrease the risk of that leaking. That's new data coming up. That's just in my little surgical realm. You know, there's data in rheumatology, there's data in hepatology showing we can decrease fatty liver, we can decrease hepatic encephalopathy, we can decrease the progression of the encephalopathy, we can show fatty liver is enhanced in that population. In rheumatology, we can show decreased inflammatory changes, you know, so in decreasing antibiotic-associated pneumonia, decreasing Clostridium difficile pneumonia, you know, which was responsible for 30,000 deaths last year in the United States, we can decrease that. The future for probiotics in clinical medicine is literally in its infancy, and it's only beginning to grow so rapidly that almost now it's difficult to keep track of. We have a lot of questions. What's the optimal dose? We're not sure. What's the optimal route of delivery? We're not sure. What's the optimal timing of delivery? We're not sure. So I think that's what we're going to sort out over the next 5 years. If we look back in 2005, there was like 1,000 articles published on PubMed on probiotics, and this year is 25,000. It's gone up tremendous. So there's a tremendous amount of clinical data out there now in major high-quality journals. It's not just these little throwaway fly-by-night journals. There's high-quality journals, Annals of Internal Medicine, Annals of Surgery, you know, major journals that are supporting the use by large trials.